My name is Michael Sutherland. I've been involved with the American College of Surgeons for over 20 years now. I started out as a resident and have progressed through to being a fellow at this point. It's a main part of my activities in organized medicine. Many of those activities that we deal with in terms of the paperwork or the regulatory aspects of what we do don't seem to impact the patients directly, but it's something that if we don't take seriously and don't follow through on, then it adversely affects our patients because those things don't get done. And then the patient is the one who has a problem either with their employer for FMLA or from the billing perspective in terms of getting their claims paid. Regulations do add burden to the amount of access that patients have. So I think that's the biggest problem. We spend a lot of time going through these exercises to achieve the amount of completion of the paperwork or dealing with the insurers, and it ultimately slows down the efficiency of the office, decreases the number of slots that are available for patients to have access, and really poses a challenge for us to be able to deliver care to the same number of people that we would otherwise have in the practice because of the amount of time that we spend working on these regulatory issues. We run into problems with pre-authorization issues. Spend a lot of time on the phone working with insurers to get those pre-authorizations approved, and then run into problems on the back end with questions about whether or not they're going to pay for that procedure even after it was pre-approved. A lot of my practice is acute care surgery, so emergency general surgery and trauma, and we have to jump through hurdles about procedures that we did as an emergency operation at 2 o'clock in the morning that is going to be denied payment because we didn't have a prior authorization. It's incumbent upon us as surgeons to represent our patients in their best interest by engaging with the legislators or the other policymakers that are creating these rules and regulations to show them the impact that they have and represent how it affects the delivery of care to the patients in our communities.